Nepal, a small, beautiful, landlocked country, rich in natural and social diversity. Within this beauty lies some hidden problems. One of the examples is HIV and AIDS. HIV is a virus transmitted by unprotected sex and sharing used needles. People who inject drugs are 22 times more at risk of getting HIV compared with the general population. UNAIDS data show that in 2009, HIV prevalence among people who use drugs in Kathmandu Valley in Nepal was 20.7%. The issue is that high-risk groups such as people who inject drugs have the least access to HIV prevention and treatment while they need it the most. Social taboos around sex and drug use, as well as stigma and criminalization around drug use, forces people who inject drugs to behave in riskier ways and discourages them to access health services. Nepal was the first developing country to start a harm reduction program to prevent the spread of HIV. Harm reduction are policies and programs that aim to reduce the negative impact of drug use. In 2002, Youth Vision started to address the HIV and AIDS epidemic among people who inject drugs. Since 2011, they became part of Bridging the Gaps, a Dutch-funded program to end the AIDS epidemic among key population. This support enabled a long and productive collaboration between Youth Vision and Dutch harm reduction organization Mainline. One example of harm reduction services Youth Vision provided was the needle and syringe program. Local field workers and peers reached out to the users in most pressing need and provided them clean needles, syringes, and health education, like how to inject safely. This reduced HIV transmission significantly. Staff also helped users access HIV testing and joined them to visit public health services for treatment and follow-up support. Youth Vision also provided a legal substitute for the illegal drugs called buprenorphine. By taking this substitute, it minimized injecting drug use and lowered the risk of contracting HIV. Youth Vision became the first Nepali organization providing substitution treatment, and in the end, they took an expert role in overseeing government centers providing OST across Nepal. By 2017, HIV prevalence among people who use drugs dropped drastically to 8.8%. And at this moment, such programs are available across Nepal through the support of international donors. Youth Vision is now capacitated to deliver services themselves and works hard with other drug user organizations, ministries, and law enforcement to improve drug policy and implementation in Nepal. The government shows political will to support programs on HIV and drug use. So there is better access to prevention, testing, and treatment services, as well as safer injecting. HIV prevalence decreased drastically and there is political will. But are we there yet? Not yet. Nepal is one of the poorest countries of South Asia, a place where basic access to food, education, housing, and healthcare is a challenge for many. HIV and AIDS prevention programs are still funded by international development partners, and the government doesn't yet have the system in place to provide these services themselves. To further develop sustainable results, international financial support remains necessary for HIV response programs, where key populations themselves are in the driver's seat. Only then will we be successful in ending the HIV epidemic among high-risk communities, like people who use drugs.